We've actually studied it and found that when it comes to relationships with patients and having them follow the health advice they get from their doctor, that empathy is more important than expertise. Of course you need expertise. There's no question. But if someone doesn't think that you care about them, if someone doesn't feel like you're listening to them, if you make them feel stupid, they are not going to listen to what you have to say, because that's going to cause them to be very defensive right away. That's a natural tendency. If someone makes you feel stupid, to push back. So we're trying really hard to train our future doctors about the importance of these conversations, of meeting people where they're at, and just trying to help guide them through.
Here we go, another week of a closer look across the Village Media Network. It's Monday, the 23rd day of February. Whew, that was a tough one.
Yeah, I'm still in mourning, I think.
I've been kicking a pop can since 11 o'clock yesterday morning.
Yeah, that was what I guess they call sudden death overtime. That was like a sudden death.
Yeah, I'll tell you, the country's feeling it. You know, this 3-on-3 crap.
I know.
And I understand why they do it. They do it because they don't want the game to go 5-6 hours, right?
You're going to have a closing ceremony.
You got closing ceremony. It's the networks that drive this, right? Let's be clear about that. It's not the league. It's not the IOC. It's the network saying, you know, we've got a timeline to stick to.
Well, we're jumping ahead, but did anyone? Still don't understand why they went. Because when Crosby scored that overtime winner, it was a 4-on-4 game in Vancouver.
Yes, it was.
What's the change?
I don't know.
Did they follow the NHL's? Is that what it is?
Well, even the NHL will in the Stanley Cup playoffs and certainly in the final. Yeah. It's 5-on-5. Yeah. You know, till death do us part.
Okay, forget all that. We all knew the rules going in. We knew the rules going in. We did. I think for me, it just, like we've talked about on the show already, it just means so much. It felt like we had to win that game, and we did everything possible to win that game. I'm not a hockey expert, but man, especially the third period, it's like the United States weren't even in the game. Am I wrong?
No, I think you're absolutely right. In fact, Canada's only breakdown from my vantage point was the very first shift of the game, where they came out and I thought, oh my God, they look flat. Yeah. And then it's like they woke up and totally dominated. And
they had multiple chances in the third to kind of score that go-ahead goal.
Well, I mean, Derek is here, and we were talking about it first thing this morning. 2 empty nets they missed. Yeah. A Celebrini and a McDavid breakaway, both missed. And a 5-on-3 power play for almost a minute and a half that garnered, a handful of shots.
Yeah. Derek, what went wrong?
Connor Hellebuck was in net for the USA.
Yeah, I think so, yeah.
That's right. Yeah, they can certainly thank him.
He was something, though. That paddle save he made. That's one of the greatest. That might be the greatest save I've ever seen. I don't know if it's just a lucky, but and the best was it Taves that shot the puck?
Yeah.
Yes.
He didn't know till after the game how he missed it.
Yeah.
Because they were asking about it in the scrum there, and he's like, I don't even know how he had to go look at the replay after. Maybe he saw it in the intermission.
Crazy.
He didn't know how it happened. But it was a huge kick in the teeth just losing that game and just feeling like everything was lined up for us to win. And the reality is the United States beat us in both hockeys.
That's the thing.
They won gold in
Thursday.
women's. They won gold in men's. And, we kind of got to just sit back and take the trash talk. And there's lots of it. There's lots of trash talk right now.
Here's what I want to know. Whose bright idea was it to give these grown men, after they've just lost the biggest game of their lives, a stuffed animal?
Yeah, what was that?
Sorry about your luck. Enjoy your Beanie Baby.
Well, it's the Olympic thing. When I was in Vancouver, they had these the mascot, whatever the symbols were. I forget what they were, but they were kind of cute.
Did you see McKinnon's look?
Yeah, I did.
Priceless.
I saw
Priceless.
That's in an Italian garbage can right now.
Yeah, exactly. I did see Sid Crosby after he sat with John Cooper for the press conference too, and I just think what a tough choice for him. He's basically saying, and he did the right thing. Obviously, he was saying I wasn't good enough to play, and if I played, it would have been worse for the team and then better. And that's a lot of.
That's a leader.
That's a leader. And then they watched the game in the training room because they won the game he got hurt in. He watched it from the training room. They won. So he watched all the rest of the games from the training room.
Because people were wondering, is Sid even in the building? Because there was no camera shots.
He didn't go up to the thing, which was. Anyways, I don't know, man.
I will say this. credit to the Americans for the tribute to Johnny Hockey.
Was pretty powerful.
Johnny Gaudreau.
Yeah.
The jersey was in their room for the entire tournament. Gaudreau's family in the stands. And then to parade his jersey around after they won and to bring his kids into the team picture.
It was pretty classy.
Full marks.
It was pretty classy. Like I said before, if this was 5 years ago, you would just take it as a tough loss against a good rival.
No question.
But it's all the other stuff that's going on in the world that makes it more difficult. Hopefully we get back to a point where it is just a really great rivalry, and we're going to win some and they're going to win some. The reality is, though, the United States are right there. They're at our level in hockey. And we've seen other countries too. Yeah. The World Juniors, we're not doing very well in the last few years.
Nope.
Other countries have caught up. And that's just kind of I guess it's a good thing for hockey that it's just, it's more about. But that was tough, man. That was a tough.
I think one of the greatest games I've ever watched.
It was phenomenal.
Start to finish.
It really was. And Makar, did he score in the third to tie it or the
second?
That goal was just unbelievable. And you felt like, okay, it's going to turn. The tide's going to turn right here.
Well, ironic that it was him that kind of lost his edge in overtime.
I know. But when they dropped the puck in overtime, I'm sorry, everybody who thinks they're logging on to not listen
this is
to hockey
Canadian.
pod.
This is a
We're going to
Canadian.
stop. We're going to stop talking about hockey. But I was worried as soon as they dropped the puck in 3-on-3. It's just a crapshoot. Who knows who wins the draw? And it's all, it's not really hockey, as John Cooper said.
Well, it isn't. And from what and again, like you, I'm not an expert, but the key is to win the draw and play keep away until you get an open lane and create a 2-on-1.
Yeah.
That's,
This is the last thing I'll say. But then, you look at Marner, was it the quarterfinal game when he went through everyone and scored?
Yeah.
That was a risky play. It worked out great for him.
Yeah.
But if he had missed a shot, then they would have taken over and been back on a break. So there's no good way to do it. But I just think we're not as great as we think we are.
We are not, but we'll get them in 4 years.
Yes.
We should flash back a couple of weeks ago when Sid Seixeiro was on the program.
Oh, this is what kills me too. Yeah, I forgot all about this. I was all bummed because Sid told us it is going to happen. Derek, can you roll that clip from Sid?
Canada's going to win the gold. Canada is going to win the gold by an easy, comfortable margin. This will be, they don't have to build dressing rooms properly in Milan. They can put them in a bus shelter to get changed. Canada and Makar and McDavid and Crosby and McKinnon are going to show up. They're going to kick their ass in a severe way. We're all going to be up at like 8 o'clock that Sunday morning, later this month watching it. And it's going to be the greatest thing ever.
Well, so much for predictions, Scott.
Yeah.
It is what it is.
It's going to be a long 4 years.
Yeah.
All right. Canada has a new top doctor.
Yeah, that's cool. We're going to flash
Terrible
back.
segue, but
We're going to flash back again for tonight's show. Forget Sid Seixeiro. We're done with that. Canada lost. We'll wait till the next Olympics. Dr. Joss Reimer was president of the Canadian Medical Association last year, and she was on our program. We had a great discussion about medical misinformation, about how you fight the flood of disinformation from the anti-vaxxers and that kind of stuff.
Right.
And her message, what really stuck out for me was the best way to tackle people who believe in the misinformation is with empathy and to speak to them as humans and say, hey, I care about you as much as you care about you. I'm your doctor. I want this to work out for you. So let me try to help you understand what's fact and what's fiction. Instead of that kind of like, oh, you're so stupid. Why do you think that? She really, she wanted to meet them where they were coming from. And that was because we had talked to her in the at the time when last year's research came out about the latest state of kind of where medical misinformation is and how much people trust their doctors. And it was a great conversation. Then I saw, you actually sent me the link when she was first named, is it the new chief public health official? Is that the right term? Sorry.
Chief medical officer of
that's
health
right.
for Canada?
Dr. Theresa Tam had the post for a long time during COVID. Yeah. She's replacing her. I rewatched the interview today, and it's a great interview. I think it's a great opportunity to just remind people who Dr. Reimer is, the talent she brings to this job, the passion she brings to this job, and I think it's a perfect time to do it. So let's go back and hear from Dr. Reimer.
On the line with us today on the program is Dr. Joss Reimer, the president of the Canadian Medical Association. Doctor, great to have you on the show. Thanks for your time today.
Oh, thanks so much for having me.
Okay, let's start. You guys recently commissioned Abacus Data to do a survey. I want to start with why did you do the survey, and more importantly, what did you learn from it?
Well, we're seeing misinformation flourishing online, and that is causing problems for Canadians who are struggling to get the information that they need. They're struggling with access to healthcare and at the same time being forced with misinformation. But the reason we did the survey is because we need to measure this. We need to have a way to know if things are getting better or worse. Are the things that we're doing working or not working? So it's critical that we get the information from surveys like this to help inform our policy decisions and our advocacy.
And we'll talk about some of those numbers in a couple of minutes. I read a quote from the Globe and Mail. You were quoted, and I just want to read it back to you. You said, "We're seeing both a crisis of access to care along with the crisis of misinformation." So it almost makes for kind of a perfect storm. Can you just kind of build on that comment that you made and what you meant by it?
Yeah, I mean, I can't really think of any other generation that's had this double whammy where both they're being bombarded with misinformation that's being forced at them through algorithms on social media, whether they're looking for it or not, and also having this lack of access to care where we have 6.5 million Canadians who don't have access to a family doctor. And so, of course, if you can't have a doctor that you can have that trusted relationship with and ask your health questions to, you're going to go online. That's a natural thing for people to do. So we worry about what do they find when they're online? Do they know how to find good sources of information? And what do they do when they see information that may or may not be true? How do they evaluate that and help make good decisions for their health?
Does the CMA have good advice on that, doctor? That's a great question because we've all had health issues in our life that we go through, and you do search. You're talking to your doctor, your nurse practitioner, but you are also looking online. You're looking at what you think are reputable sources. I think as a journalist, I can tell what a reputable source is and what isn't, but I think a lot of people just don't have that knowledge. Is that part of the education that goes along with this?
And it is really hard, and we don't really expect that Canadians are going to have the background to be able to determine everything they see online and whether it's true or not. So we have produced some material about how to recognize misinformation. What are the red flags? So we want people to take a step back when they see health advice, especially on social media, and think about, what's the source of this information? Who is the person that's telling me this? Do they have the credentials to back it up? Do they have education in this area? What are they telling me? Why are they telling me this information? Are they selling me something? So if someone's telling you, don't take your diabetes medication, instead buy my supplement, that's the kind of thing that we're saying is a red flag. Not to say that their information is necessarily bad, but certainly when there's that other incentive reason that they're sharing information with you, then we want people to take a step back and then go to something like Diabetes Canada to see, does this information hold up with the experts? Because that someone like Diabetes Canada, they're not selling you anything. They're really there because they have your best interest at heart.
Mm-hmm. Doctor, who's pushing this misinformation? Why is there so much of it?
Well, the big challenge is really that the social media platforms are the ones pushing it. The algorithms force that information on us whether we want to see it or not, and they profit off of that information coming at us. And we know that misinformation spreads far faster than true information online. We know on Facebook, for example, that misinformation gets 6 times more engagement than factual news. And so those are the types of things that are really challenging because the algorithms are designed to push that at us. And the more of it you see, the harder it can become to find truth and to understand when you're seeing factual information. So we do worry about the content creators who are trying to push this stuff and sell you your diet plans and your supplements and your anti-vax information. But even more than that, we worry about the algorithms because that's really who controls what we're being faced with and what's really manipulating us in our social media spaces.
And let's talk about that for a sec, Doctor, if we can, just looking at some of the numbers and the question, the trust in news and social media. Facebook and Twitter, or X as it goes by now, towards the bottom. And of course, Mark Zuckerberg just announcing in the last week or so that now Facebook is just getting out of the fact-checking business. So it's going to be even more of a cesspool.
Yeah, that was something that was disappointing for everyone working in this space. We know that misinformation is doing very well out there. And so the small checks and balances that exist and seeing those disappear is something really discouraging because we're seeing these harms. The survey showed us that 23% of Canadians have experienced a harm because they followed advice they saw online. And that's just the 23% who either recognized it or were willing to admit that they had that harm. So this is happening. And even in my own practice, I was recently doing a shift at a women's hospital, and there was a patient there who had a really bad bleed after having a baby. And postpartum hemorrhage is what it's called. That's the #1 cause of maternal death in the world. So this is a really serious condition, and she needed a transfusion to replace that blood. But she declined the transfusion because she didn't want to receive vaccinated blood. So because of misinformation, this was someone who's trying to make the best decision for herself, for her family, for her new baby. And because of this misinformation, it became a life or death situation for her. And every physician has stories like this. We want to be there to provide good information to people, but when they're being overwhelmed online by misinformation, it can be so challenging for people to navigate through.
That's a heartbreaking story just to hear that.
It really is, and I wish it wasn't a true story.
Yeah, I believe it 100%. I guess there's political figures in the world who are pushing that misinformation too, right? We live in a world where people like Dr. Fauci in the United States are seen as someone that we shouldn't be believing. And it points to even the fact the data that you guys have found here, even the fact that, to me, it's surprising that only 80% of people trust their physicians. But that means 20% of people don't. Does that seem off to you? I mean, you'd think it'd be 99% of people would trust their doctors.
I don't think that we can find 99% of people who trust any one group. So we were really encouraged to see that physicians were still the most trusted health professionals out there. And we've even seen there's a global trustworthy index, and physicians are still globally the most trusted profession worldwide. So there's a lot to be said for that important trusted relationship, especially when you can have it over a long period of time and you get to know them and they have your health knowledge and your best interest at heart. So it's really important that we work, while we're talking about this information, we also need to be working on the healthcare system, because access to care is a big part of this whole problem. And when you don't have that trusted relationship, that's probably where some of those 20% of people fit in, is that they don't even have a relationship with a physician. So how do you have a trusted relationship when you can't access them at all?
That's a great point. We're going to get into that for sure. I just want to go back to that story again that you just told. How is a doctor, or any doctor, how do they approach that situation? Do you actually try to sit a patient down when they come up with something like that, where I don't want vaccinated blood from a transfusion? How do you even begin to have a conversation? What do you try to tell a patient in that situation?
Those are really difficult situations because you know that this person is trying to make good health decisions. Nobody's trying to hurt themselves. Nobody's trying to make some decision that's going to harm their family. And that's where it's really important to start, that we have a mutual interest in this person's health outcome. We're both trying to have a good outcome for this individual. And that's where we always try to say, we right now disagree on how we get there, but I am here because I care about your health outcomes. And so a lot of times what we find in those conversations is you don't necessarily convince somebody that day, but the trusted relationship and the fact that they come back is where you can build that over time. Now, in that moment, it was life or death. It was right at that moment. You have to have that conversation right then. But even more important is having somebody who could have been having those conversations over the years leading up to the birth of that baby, so that when she was there, when she was having her baby, and having that conversation with someone she trusts, you're more likely to be able to help somebody navigate through a difficult situation. We've actually studied it and found that when it comes to relationships with patients and having them follow the health advice they get from their doctor, that empathy is more important than expertise. Of course you need expertise. There's no question. But if someone doesn't think that you care about them, if someone doesn't feel like you're listening to them, if you make them feel stupid, they are not going to listen to what you have to say, because that's going to cause them to be very defensive right away. That's a natural tendency. If someone makes you feel stupid, to push back. So we're trying really hard to train our future doctors about the importance of these conversations, of meeting people where they're at and just trying to help guide them through.
That's an excellent point, because we've all been on that other side where we're speaking to our doctor about an issue and that is so critical, that you actually feel like they empathize with you and you can trust them, which speaks to the main finding of the research, right, doctors, that 1/3 of Canadians are turning to the internet for health information due to that lack of access to a primary care provider, which is the big question, right? So you're the Canadian Medical Association. What do we do today to try to turn that corner to actually get more doctors, more nurse practitioners?
Yeah, I think that was the most sobering stat in the whole survey for me, was that 37% of people say they have no choice but to go online because they can't access a doctor. So we're working with the federal government and provincial and territorial governments to do two big things. There's lots of things we're working on, but the two I want to talk about are team-based primary care and reducing administrative burden. So team-based primary care, we don't have enough family doctors. The number of family doctors we have per capita is lower than most European countries. It's not meeting the needs of Canadians. And so we want to do something in the short term while we're trying to build up more family doctors. But They have 10 years of university education, so we can't quickly churn out more family doctors. So in the meantime, and ongoing, we want to have team-based care where you have a pharmacist, the nurse practitioner, a social worker, a physiotherapist, all working together, sharing a space, sharing a health record, and caring for people together. Because we know that when we use our different expertise and our different training together, that we can provide better service to patients, and we can provide service to more people than that family doctor could do alone. And I did that in my own practice. I had, a clinic where we had the social worker, occupational therapist, counselor, dietitian. And when I had someone come in with their pregnancy-related diabetes, they'd go see the pharmacist who would teach them how to use the glucometer and check their blood sugar, and then see the dietitian who would spend way more time with them than I could, talking about diabetes-friendly, low-cost diets. And that's what we want to build up, and we need to have funding, though, for that, because right now, most family doctors pay for everything that happens in that clinic. They have to hire the staff, they pay the utilities, they pay the rent, and they can't afford to hire very many people before they run out of money. So we need to work with the governments to find new funding models to bring the nurse practitioner into the clinic with the family doctor. And then on the administrative burden, our family doctors are spending 10 to 19 hours a week on paperwork. Like, that's so much time. Think of how many more people we could see if we could reduce that. So we want to do things like decrease the number of forms that we have to fill out, make the forms more similar across different insurance companies, decrease the portion that the doctor fills out, and get rid of sick notes. Because sick notes seem to be bad for just about everyone. Like, when you have a headache or a cold, nobody wants to go see their doctor. You just need to stay home and get better. And, us seeing you just so you can get that paperwork filled out for a human resource issue is not a good use of our time. And in fact, we do it 12 million times a year in Canada.
Wow.
So it is not a minor issue.
We talk about the 37% of people turning to the internet for information. A number that really stood out to me, and I'm sure it did to you as well, Doctor, and I'm curious your thoughts on this. 42% of respondents tried medical advice that they had found online. To me, that is mind-blowing and really shows how desperate people are.
Yeah, almost half of us are following advice we see online. And some of the respondents, I don't remember the exact number right now, but I think it was somewhere around 30% have followed online advice that disagreed with their own doctor. So the misinformation is powerful, and those algorithms are powerful. They're really good at dealing with human psychology, and they're good at getting you hooked and getting you in there and capturing your attention. And so this is going to take a lot of effort from us. And that's why the Canadian Medical Association values a healthy media ecosystem. So we're actually funding health journalism in Canada because we need to have that traditional media still present as a base where there's referenced and well-researched information happening. But we also need to be in those spaces where Canadians are. So we have a platform, a channel, Healthcare for Real, that's on Instagram and YouTube and Threads, where we're sharing information about the Canadian health system because it's complex and hard to understand. And we want to be part of that solution. And we have a network for physicians who are on social media spreading good information, and we're trying to support them, give them the tools that they need to be part of that solution.
What gives you hope, Doctor, when you see a report? This is kind of depressing when you kind of see these numbers, right? You talked about those things, the positive things you're doing, but what gives you hope? Because sometimes I wonder, the age of misinformation is so great and so large, and it seems to be growing, and I wonder in 5 or 10 years where we're going to be. Do you feel like you can turn the corner on this and that this will not continue to get worse, say 10 years from now?
Yeah, I don't know if hope's the word I would use right now, because honestly, I feel more worried about this than I've ever felt in the past. But what I do feel is driven. And I know that there's a lot of other healthcare professionals who also feel really driven by this. And so I am so encouraged when I see the passion in the Canadian health professionals who want to be part of these solutions. There is so much effort and care and empathy and passion in that group that are out there and trying to reach out to Canadians. And so we know that this group is going to keep fighting this battle because we care. We went into our healthcare fields because we want to help people. We want Canadians to be healthy. And so I know that this group is going to keep pushing on social media, in traditional media, and then in those one-on-one interactions with our patients.
There she is, Canada's new Chief Public Health Officer, Dr. Joss Reimer, and our thanks to her. That's it for us tonight. We'll be back again tomorrow evening at 7 o'clock. Reach out anytime. Closer Look at villagemedia.ca or closerlookpodcast.ca. Sign up and we'll send you newsletters every night of the week. For Michael Friscolanti, our editor-in-chief here at Village Media, Derek Turner at the helm as always, I'm Scott Sexsmith. Thanks for watching. See you tomorrow night right here on Closer Look.
Frisco and Scott's Wardrobe provided in part by Moores, Sault Ste. Marie.